company did all it could with pre-existing condition, other ways to disallow care of people. I want to tell you a story about why I'm optimistic about what's going to happen with health insurance. The President, as you know, is going to speak to the nation Wednesday night. The last time, it's a highly unusual occurrence for the President of the United States to address the nation at a joint session of Congress other than the State of the Union. The last time a president spoke to the Congress in a joint session other than the annual January, early February State of the Union was President Bush spoke to the nation right after September 11th about the attacks in New York and Washington. So the President has turned up the heat. The President understands that there is nothing, of my time in Congress, for instance, the most important vote I will cast next to the vote I cast against the Iraq War in the House, the next most important vote I will ever cast, I believe, is the one I will cast this fall in favor of this health insurance plan. The reason for my optimism is this, that the President, after an uneven August, if you will, where there was lots of misinformation from the death panels to doctors, or to you're being told what doctor you're going to have to go to what insurance company you have to have, and the government takeovers and socialism and all the things they say every time we ever try to reform the healthcare system. The reason I'm optimistic is in a lot of ways, it's what's happened. Anecdotally, in my state, but very importantly, because Ohio, as we know, is the swing political state in this country. First, the President deciding he's going to take this to the nation. He's going to go there Wednesday night, talk to the Congress, more importantly, talk to the nation about how important this is and what this health care plan is going to be about. He needs to push Congress. He needs to push those members of Congress that lean a little bit too close to the insurance industry, and he's got to talk to them about the public interest. That's what he's going to do Wednesday night. But two other things happened that I want to share with you. One of them was in Cincinnati. Last Tuesday, just 2 days ago, I did a town hall meeting in Cincinnati. You all know that those town hall meetings around the country have not been pretty, have not been fun for much of anybody, have been nasty, have been angry. I was advised by several people in my office, don't do one in Cincinnati. Go to Youngstown, go to Akron, go to Cleveland, go to Columbus, go to Dayton, go to Toledo, go to Warren, go to Niles, go to Ashtabula, go anywhere but Cincinnati because it's the most conservative part of Ohio. That's why I went there. We got a large room about this size, a little big lecture about half again as big as this room in Cincinnati. We had the chairs packed together even more closely than here. We had about 900 people, about 1,100 people in that room, and then about another 500 in an overflow room, or about another 400 overflow, about 1,500 total. This is the most conservative part of Ohio. Of those 1,500 people, fewer than a third were opposed to the plan. 1,000 of the 1,500 were supporting our health care plan in the most conservative part of Ohio. There were 100 that were particularly angry. They tried to shut the meeting down. They were unsuccessful in shutting the town hall meeting down, just like they're going to be unsuccessful in shutting our health care efforts down. The second thing was smaller than that. I was in Akron earlier today. I just came from Akron, actually. But I was there at a fairly early morning meeting. It was at a place called Open M, which is a wonderful social service agency in Akron that was once religious-based, sort of religion-based, but ecumenical and non-denominational. And it was they feed the hungry, they provide legal services for the poor, and they have a free clinic there. And as you may know, Ohio has twice as many free clinics today as it did 10 years ago, which underscores the problem. The day before, probably the 36 hours before I came to this thing at 9 o'clock this morning in Akron, talk radio, conservative talk radio in Akron, was doing what talk radio does. They said, go to Open M, boycott Brown, or protest Brown, call in names, do this, do that, block the driveway, do everything you can to make him understand that his whole public option he wrote, and all this healthcare bill is socialism and all that. Well, people on our side of the healthcare debate heard about these exhortations on the radio. And when I arrived at right around 9 o'clock, about 2 minutes after 9, there were 50 people with signs saying healthcare now, and there were 0 people protesting. And that tells me that with all the noise that the far right has made, with all the Sarah Palin and the death panels, with all the scare tactics, it's always about fear. It's always about fear. It's been fear of communism, fear of race, fear of immigration, fear of big government, fear of the government taking over your health care. That's the way that the far right of this country has played for decades, always playing on people's fears and hatreds of the unknown. That's what they're trying to do here. It's simply not working. I can sense just in the last week or two a turn among the public, and the people are saying, reasonable people, it doesn't matter their party, Republicans, Democrats, Independents, reasonable people are saying, this stuff they're saying is not true. This kind of carrying guns into these town hall meetings is not right. The threats saying that the president is not from this country, all of these kinds of things are simply backfiring on the far right, and people are starting to see that. With that, I'll close, and with these words. I just last week, well, I guess I got home a week ago yesterday. I went to Afghanistan for 2 days, and Pakistan for a day. One, to visit troops, and second, to see people who, just to talk to our soldiers, to our military leaders, to our civic, to our agriculture advisors there, all of that in Afghanistan. And I had lunch with in Kandahar in southern Afghanistan. I had lunch with several American soldiers, several Ohio soldiers. 2 that particularly stood out were, one was a young woman, about 20, who was at community college in Dayton, and she was called up right in the middle of getting her education. She had enrolled in the National Guard, joined the National Guard because she needed the education benefit. The other was a 40-year-old woman who, I don't know her age, but a woman who had just had her 5th grandchild. And she looked to be about 40, and she was equal. They both were equally committed to our efforts and equally committed to serving their country. And it was inspiring, of course, and gave you such confidence, and it made you so grateful when I talked to them. But the other thing that struck me is when I walked around, I was there only 2 days after they had their elections. And you know how elections in the developing world sometimes are, especially in countries that have had great violence. People, when they vote, they dip their finger into a blue ink well. And as I walked around, I saw so many people that had their finger, had this much of their, always the right hand, always the index finger, with blue stains or blue ink stains. And you may remember, you may have read that the Taliban said that anybody that votes is under the threat of they're putting their lives at risk, that perhaps to cut their finger off, perhaps to do more than that. That focus was especially on women. They especially threatened any woman who voted that they would cut her finger off or something worse. Yet 5 to 6 million people in that country voted, and it really did. It really said to me how much we have here. How the fact that we can do meetings like this, the fact that I can go to Cincinnati and have 100 people call me names even, is something that lifts me up and inspires me and makes me realize that the progress we've made in this country, the progress symbolized by the canary in the mine, the progress that we've made in providing and building a strong middle class, the progress we've made in civil rights and women's rights and protection of children, the progress we've made in the labor movement. We have so much more to do in all of those areas, but we've come so far, and your turnout tonight and the work that this center does inspires me and tells me we're going to accomplish much, much more. I will stop there. I'd love to hear your questions.